Good afternoon to everyone, or good morning for those who are just starting the day. We are very pleased that you are interested in this webinar and have joined. This webinar is part of WHO's efforts to improve dissemination of our global technical guidance to a broad audience. Similar webinars will be held for all subsequent malaria guidance issued by the WHO from now on. What I'm going to present are recent updates in the test procedures for insecticide resistance monitoring in malaria vector mosquitoes. This work was developed by the Entomology and Vector Control Unit of the Global Malaria Programme here at the WHO, and it was published online in November 2016 in our website. I would like to start talking about the role of insecticides for malaria prevention, the threat of insecticide resistance, the importance, measuring it, and the rationale for introducing new methods to the current test procedures guidance, and what those methods are. Insecticides are an important element of an integrated approach to vector control. An analysis was conducted in 2015 that looked at malaria trends since year 2000. A significant reduction in the burden of malaria was evident worldwide, and it was estimated that 633 million cases were averted in sub-Saharan Africa as a result of the scale-up of malaria control interventions. Around 80% of those gains were due to the use of insecticide-treated nets or indoor residual spraying of insecticides. Insecticide resistance is a threat in the fight against malaria. Resistance is defined as the property of mosquitoes to survive exposure to a standard concentration of insecticide that would otherwise be fatal. It is important to point out that the emergence of insecticide resistance in vector population is an evolutionary phenomenon, and the increase is associated with the selection pressure for the use of insecticides. Resistance to all classes of insecticides recommended for adult malaria vector control has been reported, and as you can see in this slide, this is a common problem in all regions. Insecticide resistance monitoring is an important part of a comprehensive entomological surveillance. This is generally done in sentinel sites, which are selected based on criteria such as the level of malaria transmission, ecoclimatic zones, history of insecticide use, not only for public health, but also for agriculture, vector species, accessibility to those sites, as well as available resources. In 2012, the Global Plan for Insecticide Resistance and Management in Malaria Vectors, GPERM, was launched and included a framework for action in 5 key areas. Those areas are planning and implementing national insecticide-resistant management strategies, ensuring entomological and susceptibility monitoring and effective data management, developing new and innovative vector control tools, filling knowledge gaps on resistant mechanisms and the impact of current insecticide-resistant management approaches, and enabling mechanisms to improve advocacy and build human and financial resources. Besides insecticide resistance monitoring, I also want to highlight how important the regular evaluation of field operations is. It helps ensure the quality of insecticides and the quality of the operations themselves, and also ensures that these methods are efficacious against the vector populations and the disease. The first edition of the test procedures for insecticide resistance monitoring was launched in 2013 and updated mainly the interpretation criteria of these tests. The current procedure to evaluate the presence of insecticide resistance in a given population of vectors is based on the exposure of mosquitoes to discriminating insecticide concentrations. However, this procedure does not measure the level of resistance, does not give any information on the likely impact of resistance in the field. It also cannot be used to compare the levels of resistance between insecticides or between populations. These were some of the reasons for the need to update the 2013 test procedures. Because the different class of insecticides can share mechanisms that confer resistance, it is important to know which mechanisms are involved in the resistant profile of a population of vectors. For example, as you can see in this chart, elevated monooxygenases, which are a metabolic resistant mechanism, could have an important effect on pyrethroids, but also carbamates. A similar situation is found for target site mutations, as you can see here. Biochemical and molecular methods are available to measure these mechanisms, but in general they are used for research institutes and are not practical for use as a routine for malaria programs. In December 2015, the Global Malaria Programme provided recommendations regarding the conditions under which long-lasting insecticidal nets treated with pyrethroids and the synergist PBO should be used. One of the recommendations was for countries to collect data on the presence, level, intensity, and mechanisms of resistance to all insecticide classes. In order to facilitate the collection of these relevant and important data for countries, the update of the test procedure was then proposed. This second edition of this guidance was launched in November last year, 2016, with a focus on new test procedures to provide more operationally meaningful data. These new test procedures are based on the existing susceptibility tests. Another existing method is the CDC bottle bioassay, which has also been used in some countries, mainly in Latin America. The second edition of the test procedures includes a way to measure the intensity of resistance and a synergist insecticide bioassay, both using the same tubes and impregnated papers as the normal susceptibility test. The intensity bioassay measures the strength of the resistance in a population, and the synergist bioassay provides an indication of involvement of metabolic mechanisms in resistance. The intensity assay is conducted once resistance is confirmed using the discriminating concentration. It involves exposing additional test mosquitoes from the same site to 5 and 10 times the discriminating concentration. According to the percent mortality observed, the intensity of resistance is then classified as low, moderate, or high intensity resistance. This information is then used to monitor the evolution of insecticide resistance and for decision making for its management. Impregnated papers are available for the discriminating concentrations and the 5 and 10 times greater concentrations for intensity assays, as you can see in the table included in the new edition of the test procedures. This slide shows the interpretation of the results of the intensity assay. After finding resistance using the susceptibility assay, mosquitoes from the same locality are exposed to 5 times the discriminating concentration. If mortality is higher than 98%, this population has a low intensity resistance and there is no need to expose them to a higher level of concentration. If mortality is lower than 98% when exposed to 5 times the discriminating concentration, you should then expose mosquitoes from the same locality to 10 times the discriminating concentration. And if mortality is greater than 98% at this level of concentration, then there is a moderate intensity resistance. However, if mortality of the mosquitoes at this higher level of concentration is less than 98%, it means that high intensity resistance is present. These confirmed levels of resistance at 5 times and especially at 10 times the discriminating concentration may indicate or predict operational control failure and highlight a particularly urgent need to develop an appropriate resistance management strategy. Now we move to the other method included in this second edition of the test procedure, which is the synergist assay. The idea is to pre-expose mosquitoes to a synergist. For now, this method is only available for the synergist PBO. After this pre-exposure, mosquitoes are then exposed to the insecticide for 1 hour, and mortality is then measured after 24 hours. The interpretation of these results could be a complete restoration of susceptibility, which means that the monooxygenase-based resistance mechanisms fully accounts for expression of the resistant phenotype. Partial restoration means that another mechanism may be present, and no restoration means that the resistance detected is not based on monooxygenase mediated detoxification. This example represents the 3 possible outcomes when using the synergist bioassay. As you can see, the first 2 columns are showing a complete restoration of susceptibility or a partial restoration in the middle and no restoration in the right part of this graph. This slide is showing a summary of the process for insecticide susceptibility testing, including the intensity evaluation and the determination of the mechanisms present in the resistant populations. As you all know, you must first test for the presence of insecticide resistance using the susceptibility test. If you confirm the presence of resistance, you can then test for the intensity of that resistance using the intensity assay. And you can also test for the mechanisms of resistance using either the synergist bioassay or any molecular or biochemical assays. You can find this diagram in the guidance document. To conclude this presentation, I would like to show this chart from the Global Plan for Insecticide Resistant Management, in which understanding the severity of resistance and the mechanisms underlying the resistance are highlighted and are useful information linked to action in the management of this program. It helps program managers know when emergency action is needed. Many thanks to all of you for your attention and looking forward for your comments. Thank you.